Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'll be speaking with Dr. Doug Iliff of Topeka about GERD. Thanks for being here today, Dr. Iliff.
You're welcome, Amy.
My first question is just simply, what is GERD? What does that stand for?
GERD stands for gastroesophageal reflux disease, also known as heartburn, acid reflux. That's the basic concept.
Okay, and how might someone end up with GERD?
Well, the problem in America right now is that Americans keep getting fatter and fatter. That fat causes a stretch of the abdominal wall. It creates back pressure. So at night, that pressure pushes stomach contents up against the lower esophageal sphincter. Now, the sphincter is the valve that keeps food from, gets food down into the stomach and keeps stomach contents from going back up. When it's bathed in acid at night, it gets damaged. The sphincter is a circular muscle. When it gets damaged, it swells. When it swells, it can't close, and then stomach contents come up. The problem is that those stomach contents over a long period of time cause a variety of problems. Besides just simply heartburn, it causes sometimes a cough, it causes laryngitis, it may cause asthma. These are called silent reflux, and it's a real problem.
Okay. Are there medications to help with this?
There are terrific medications to help, and proton pump inhibitors are the class we use most often. It's available generically as omeprazole. It used to be Prilosec and others. The problem is that although we've got great drugs to treat the symptoms, we're now seeing a rise in esophageal cancer, and that's a real worry. We think that's because we're still getting stomach contents up into the esophagus, although it's not hurting. And so, I've gone back to, in addition to drugs, I've gone back to barrier methods as a way of treating this. It's what we used to do when I was in my training. Early on in my career, we just didn't see reflux disease the way we do now. So here's a couple of ideas. This is a bed block. The head of the bed, uses them in pairs, the head of the bed goes into here, and it raises the head of the bed about 6 inches, so you're sleeping downhill. That causes gravity to help stuff stay in the stomach where it belongs. This is Gaviscon foam tabs, creates a foam barrier at bedtime to keep acid from coming up into the esophagus, and that's a great idea too. Now, there are some other things that are fairly simple things to do. Don't eat 3 hours before you go to bed. That cuts out evening snacking, and of course, what does that do? That's going to help with the problem of weight in America. And then you avoid things that we know cause problems. Alcohol at bedtime, caffeine, chocolate will cause problems, and then any spicy foods that you know give you trouble are the best things to avoid.
Okay, great. Well, thank you for being our guest today, Dr. Iliff.
Thank you.
Thank you. Please join us next week for a new health topic discussion on House Calls.